joined by Dr. Thomas Bernik, Chief of Vascular Surgery at Englewood Hospital Medical Center. Good to see you, Doctor.
Thank you.
Vascular surgery, describe it. What is it?
So vascular surgery is the treatment of blood vessels in the body, with the exception of the heart and the brain.
You started practicing in 2002. How much has vascular surgery changed in that time?
Tremendously. When we first started practice, most of the surgeries that we did were open surgeries, large surgeries that required pretty lengthy hospital stays. And with the advent of minimally invasive surgery now, that has changed dramatically.
Define minimally invasive.
So minimally invasive is a term that allows a surgeon to intervene with usually smaller incisions. It applies to general surgery, it applies to vascular surgery, and from our standpoint, most of it is now catheter-based, rather than making large incisions in different areas of the body and fixing whatever the pathology may be.
Biggest advantage of minimally invasive?
Probably aneurysmal repair.
What does that mean?
So aneurysm is a weakening in a blood vessel in the body. You may have heard of abdominal aneurysms.
Yes.
And these aneurysms classically were treated with a large either thoracotomy, opening the chest, or opening the belly through a laparotomy. And typically large surgery, about 5% mortality. With about a week to 10-day stay. Now we can do it through the groins, sometimes just with catheters, without making any incisions, and hospital stay of maybe 1 day.
This whole area of vascular medicine is fascinating to me. There's a whole family history. My dad is rewired in a certain way. I shouldn't say rewired, but I've learned a lot through that. And I was interesting. I was getting an MRI of one part of my body, and they said, you got to look at this vascular issue here. And I said, what is it? And they said, well, and they started talking about the fact that, they used that word, an aneurysm. Mm-hmm. They said, this is what it should look like, and this is what it does look like, and you need to get that checked out. And I didn't even know what they were talking about. I said, well, is it a problem? And the answer was, we don't know, but you need to monitor it. What does that mean?
So there's a genetic predisposition. First-degree relatives, particularly on the male side, have an increased incidence of aneurysms. And
an aneurysm is?
So it's a weakening of a blood vessel. It can be anywhere in the body, but most commonly it's in the aorta, which is the large blood vessel that goes from the heart to the legs. But you can have aneurysms in the legs, you can have them anywhere in the body. Once found, the aneurysm should be followed because it usually over time increases in size and it reaches a fairly critical point, which is now about 5.5 centimeters or 2 times the normal aorta size. At that point in time, one would consider intervening.
But you have to be aware of this. You have to stay on top of it, and people shouldn't ignore that.
Correct. And what we do is when we find somebody with an aneurysm, typically it's small, you can safely follow it without any real worry. We follow patients either at 6 months or a year with ultrasonography. It's not invasive.
What is it? Tell everyone what that means. Is that outside?
So an ultrasound is the same thing that one would use during pregnancy.
Sure.
It's non-invasive, it's not harmful, there's no radiation, and the patient can just come in for a physical exam and an ultrasound exam that takes 15 minutes.
What have you brought in with you?
So I brought in what's called a stent graft.
To make sure everyone can see this. Go ahead.
So a stent graft is a tube of nitinol, which is compressible.
What is nitinol? Hold on.
So nitinol is a metal that can be compressed.
That's metal?
This is metal, this is a Gore-Tex shell surrounded by metal.
Got this, Bob?
That is compressed into a size about a pencil. And once compressed, that can be put in through the artery, through the groin, and exclude the aneurysm in its entirety.
Explain that.
So we can access the arteries through the groins and go inside the actual artery and the aneurysm and the stent graft goes within the artery, and it isolates the aneurysm from blood flow. So now, rather than the blood flow go into the aneurysm sac, which is a ball, it goes through the stent graft.
Are you amazed by what you've seen since 2002 in the field?
I'm amazed at the technology changes. I really am. And this just doesn't apply to aneurysm surgery. It applies to carotid surgery. It applies to peripheral vascular disease, which is one of the more common treatments currently. It's quite prevalent in the United States with diabetes and people living longer. And most of this is done now with an overnight stay.
So bottom line here is that there's no reason for people to ignore, and there's no reason for people to experience a terrible outcome because they're not aware.
Absolutely not. Absolutely not. There's aneurysmal disease. If it's caught early, you can treat it appropriately and timely. If it's not caught early and you develop symptoms, that has a very high mortality rate.
It does. Because?
Well, because once the aneurysm ruptures, you get bleeding internally, and that becomes an emergency. So as long as it's followed on a regular basis and one doesn't have symptoms, then one shouldn't worry.
But finally, vascular surgery has come a very long way.
It has come from, like I said, open surgery, which was somewhat debilitating. We still have to do it occasionally, but most often, I would say 90+% of interventions now across the board are done with minimally invasive techniques.
Well, I'll tell you, doctor, it never ceases to amaze me the advances that are happening in medicine and research. Dr. Thomas Bernik, Chief of Vascular Surgery, Englewood Hospital and Medical Center. I want to thank you for joining us and talking to us about vascular surgery.
Thank you very much.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Oscar Health Insurance, Barnabas Health, Choose New Jersey, NJM, Cone Resnick, the Fidelco Group, and by the Russell Berry Foundation. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.